Okay.
So the Hebrew home, we've been, do we want to give everyone a minute or two, or do you just want me to
Yeah,
start?
we gotta wait until some more
Oh,
folks
okay.
show up, so.
Sounds
I'm just
good.
gonna-
Yeah.
All right, how you doing? Good to see you.
Good to see you as well.
One more person for the phone. Do we need to do?
We have five, right? Omar is still in the,
At least says 3 is required for.
yeah,
Oh, so we're formed.
We have
well,
one.
we have gone now.
That's great.
I think we only have 5 members.
So we can actually begin. There's some business we need to do. But we don't have copies of all the minutes. We have copies of some of the minutes here. However, I actually think they're all the minutes right there. So I'd just like to take a vote. We haven't been able to vote in a long time to approve all the minutes.
Need a motion?
Motion to approve minutes.
Second.
Anyone opposed? Sounds good. Okay. The next piece is the chairperson's report. I'm actually want to go to the capital and expense budget priorities. We had 2 budget priorities that we talked about putting forward. One was additional mental health services in the community. And when we talk about additional mental health services in the community, particularly wrapping itself around trauma issues, because of and focusing on 2 populations. One would be youth and one would be seniors in the community. Youth is an obvious thing. I don't think we've really dealt with the issue, and we talked about how we've not dealt with the issue of the impact of COVID and the world as it is. The world is one crazy place. I don't know how folks are living through it on a pretty regular basis, and certainly seniors. Seniors have a particular issue around isolation and the need for more mental health type of opportunities in the community. So those are the 2 areas. I'd just like to, again, any discussion on this from the members of the committee itself? Okay, anybody out there have any thoughts about the issue of mental health as a primary area for request for additional funding in the area, particularly aimed at youth and seniors? And we'll get to the senior piece in just a little bit. So again, do we have a motion?
No denying it's important. And,
Okay.
so,
So
motion.
motion, okay, approved. Number 2. Old business. Well, I don't think we have too much old business. The one thing I do want to find out is, and they asked me, should we be having a meeting in June? It would be the last meeting of the committee. This has been a tough year for all committees, from what I understand. I wasn't. Personal thing, I tried to come to the board meeting last night. I tried finding a parking spot.
It was painful.
I drove around for 40 minutes looking for a parking spot. The only thing I found was like 6 blocks away, and I'm sorry, it just doesn't hang, you know? So after all that time, I unfortunately I went home. It's really, St. Stephen's is not exactly, the ideal place for parking. Did you?
I walked.
I got there around 7:15 and I think I was circling around for about 30 minutes, 30 minutes, yeah.
Yeah, yourself?
I walked.
You walked, though, you close enough?
No.
Oh. It was insane. I was actually a little annoyed at some point. This is the second time I've tried to come to St. Stephen's. And just, a full disclosure, I have a police plaque in my window. It means I can park places a lot of people can't. And I couldn't even find one of those, because everyone just parks illegally in that neighborhood. And where it says no standing anytime, all parked up. No parking anytime, all parked up. And I refuse to park in a bus stop or a hydrant. I think I can actually park in a bus stop if I'm on call, because I'm a police chaplain. But I'm not gonna do that for something like this, and a hydrant, forget about it, so. Unfortunately, I could not make the board meeting last night, but, do we wanna, and I understand that it has been discussed at the board meetings, that there's been, rather poor attendance at some, committee meetings.
In some committees, I believe.
Yeah. So what they are talking about next year is the possibility of combining up some committees. This committee and, possibly with the aging committee, because that would make a lot of sense. And they'll have to see which other committees they can match up, and then try and figure out whether people need to belong to two committees or one committee. Two committees is a very big commitment for folks who are busy. So I'll see what happens. At this point in time, I have not indicated to them I want to become chair again next year. I've done it for 2 years. It's a big commitment on my part, as well, so we're gonna have to figure that out, but I will continue talking to the chair of the board. So I'd like to find out your opinion on having a meeting in June. I'm not sure what the agenda would be. We're supposed to have someone coming down, speaking from a federally qualified healthcare center tonight. It did not, they sort of bailed last night. But I feel that this year has not exactly exceeded or even come close to the expectations that we had at the beginning of the year. Your thoughts about this at all?
Is it possible to get somebody to talk about state budget and healthcare out of it?
Well, I could speak to someone maybe in the governor's office.
If we are able to get that, then
Okay, all right.
it would be helpful for.
All right, let's see what
community
dates,
to have a
let's see what
discussion.
dates that they have in June.
Mhm.
And I think that would be really helpful. I couldn't agree with you more. So let me see who I can
Yeah.
tap in the governor's office to come in and talk about the issue of the budget, because I know the governor made some announcements today in particular. I don't know if you heard, there's gonna be a $400 rebate check coming to folks, an inflation check, but there are certain other kinds of budget agreements that have been made. I'm not quite sure where healthcare has landed. I do know that one of the biggest concerns is Medicaid. That because of the potential cuts on a federal level of Medicaid, the state is gonna have to pick up some really big open tickets, so to speak. And there's real concern that there even is the budget to be able to do something like that, because a large portion of what came in for reimbursement on Medicaid came in from the federal government. And if they cut back in the way that they're talking about, it could be really disastrous, but that's not a guarantee. I mean, so far on healthcare, the present Congress has actually been good. They haven't cut anything severely yet, but the state of affairs right now is not exactly conducive towards being optimistic. Let's put it that way. I'm not gonna be political about it. I'm gonna guard my tongue, so to speak. So we will talk about that. One of the other parts of new business, I know last time Miriam gave a really in-depth explanation of MJHS, the four ladies. It was impromptu, and I want to thank you, Miriam, for an incredible piece. Aubrey is here from the Hebrew Home, And with this, two people that want to come in, let's let them in. That's Barbara. And Julie, okay. Hello, how you doing? Barbara, you'll be happy to note, if you look in the room, we have a quorum sitting in the room. The first time in quite some time that we've had that, so we did vote on approval of the minutes. And
Good.
we did vote on our capital expense budget priority, which is mental health, with a particular focus on youth and the elderly in the community.
Sounds
similar
good.
to similar to what we have discussed in the past, so we're gonna, take care of that, and Julie, I'm gonna need some help in figuring out what paperwork needs to be, or how I can put that in as a formal request from this committee. But it'll be so noted in the minutes, where we're at on that. Okay, what I would like to do is turn to Aubrey right now. If you can give us, as a follow-up to MJHS, a little bit more of an understanding or an overview of the kind of services and opportunities that Hebrew Home is providing in the Riverdale area and for the city in general.
Yeah, of course, happy to. So just by way of background, I'm new to the Hebrew Home as of January of this year. And in other roles with other organizations, I've always made it a point of getting involved with the community boards and the council members. And so I'm a little bit delayed, but 4 months, I suppose, isn't too bad. With that being said, the Hebrew Home started out as the Hebrew Home for the Aged in Harlem, and in 1950, 51, 52, moved to Riverdale. And so we've been in the community for since that time, providing nursing home services, short-term rehab. We offer Medicaid assisted living, as well as market rate assisted living, independent living, senior housing in Riverdale, on our campus, as well as on Johnson Avenue in what we call Hudson House. And then we also have 2 additional affordable supportive housing. It also provides housing for formerly homeless seniors over in the Tremont section of the Bronx. Each of those buildings has about 190 residents. We offer home care, both certified and licensed home care, to members across all the boroughs, Westchester and some other counties. Have some specialized services around dementia, memory care, and Alzheimer's. And then 2 programs that I'm especially proud of is our Harry and Jeanette Weinberg Center for Elder Justice, which we provide training and direct service around elder abuse for partners across all across New York State, actually. And then we also offer our HOPE program, which is for high school students who are have developmental concerns, and we provide them with training and potential employment, training through high school, and then either employment at the home or with partners in the community, ensuring that they get their education and then find some employment opportunities.
So, Aubrey, what is your role at the Hebrew Home?
Yeah, so sorry, that would have been good to know, right? My role is the Vice President of Grants, Government Grants and Relations.
Apropos to our conversation about what's happening with Medicare and Medicaid, how's that doing?
So I think with everyone, we're keeping our eyes and ears open, really trying to understand how it will impact us. On one hand, we're very concerned about the cuts to Medicaid. Medicaid is a significant portion, especially of the nursing home, and it's currently unfunded. It doesn't cover our total costs, so we use our fundraising efforts to top that off. In some ways, we look at what's going on and we say, are there opportunities? But really, until the dust settles, we don't really know what is happening. Personally, I look at some of the potential investments in more prevention and primary care is potentially beneficial, but we won't know until we know. From a behavioral health perspective, we have started training all of our staff on geriatric behavioral health, and we have some really incredible, a really incredible curriculum for that we're rolling out. As a side note, I worked with a federally qualified health center up in Buffalo before coming down here, and I've consulted with them over the years. And in 21, we were able to secure SAMHSA CCBHC, or Certified Community Behavioral Health Clinic funding. And that, yeah, and bringing together the FQHC model with the CCBHC model was really powerful. I still am in contact with my colleagues up there. They're very concerned about what's happening at the federal level, especially with SAMHSA, and how that may impact some of the progress that we've made with mental health and behavioral health. And so we as Hebrew Home are not as involved in the direct mental health care, other than any of our patients who may have some depression, anxiety, other cognitive declines, and we will care for them accordingly, but we're not a behavioral health provider per se. But again, very scary what's happening, just the again, biting my tongue, just the chaotic nature of everything that's happening. It seems that one day there's a decision made and then we're not sure if it's going to be walked back, and that's very difficult from a planning perspective.
I know I sit on the board of the Family Healthcare Centers in NYU and and they're FQHC. And you probably know Larry McReynolds from Shikany's and other groups here in New York, and we're likewise very concerned, particularly in the area of mental health, because there was a deep lacking in the area of mental health prior to. It's going to become that much more difficult to provide the kinds of mental health. At the same time, the need of mental health has grown exponentially. Another effort that I'm involved in Brooklyn has to do with what we used to only call gun violence, now we're calling community violence. And from what we understand, a big component of that, of course, is mental health. And from what I understand, that there's going to be huge cuts from the Department of Justice, from Health and Human Services, and other aspects of government in providing community-based organizations the funding for gun violence and community violence prevention programs and intervention programs. It's going to be a deep imprint in the Bronx. The impact is going to be felt all across the Bronx in the area of gun violence and community violence issues. Is that someone's hand up? That's I think. So if people are interested in accessing services at Hebrew Home, what's the protocol for that?
So anyone can go onto our website and contact us via phone, email. I believe there's a direct page. We did set up in our 800 number. It's 888-56 senior, and that is a central intake line that we can then direct callers to the appropriate service. It's interesting as you're reflecting on trauma and gun violence. We actually feel that through our Weinberg Center for Elder Justice, that with everything that is occurring, that this may have detrimental effects on just the stress and anxiety that occurs in the family unit, and the potential for abuse, and whether that's physical abuse, mental abuse, and or financial abuse, or all of the above. And we are very concerned about that. But yes, anyone in the community is welcome to reach out, either within our immediate community, or by all means, if there's an opportunity to help others, really regardless of where they may be, depending on the availability of our services. Weinberg Center is a perfect example where we've helped folks as far up as Buffalo and Rochester. So, and being from Buffalo, I know it is somewhat the hinterlands.
Right. Well, thank you. And it's we took a vote before to hold a meeting in June. Should we be able to get someone from the governor's office to talk about the budgets and the budget cuts, we should have a clearer picture what's happening in Congress, by that point in time as well. I know that the state budget was late, this time around, so it's never on time, but it's, never this late. However, without really fully understanding what will happen on a federal level, and you're right, there's absolutely no ability to plan at this point in time. There's no ability. It's what has become, normative planning for the next year has just been thrown out the window. And even, again, this is not political, it's just sort of happened. Even today, when the head of Health and Human Services was asked whether the measles vaccine was appropriate, he said, "You shouldn't take my opinion on that." So it's like, who do you turn to within the context of government if you can't turn to the Health and Human Services and CDC or your NIH to be able to really give their opinion on these kinds of things. Again, it's not just a political statement. It throws all kinds of planning and all kinds of protocol out the window. So it's become a much more difficult navigation scheme within the context of what's happening within our society. Even our request for additional funding for mental health would be a pittance in light of exactly what's needed out there. So thank you very much, Aubrey, and hopefully you can become a valued member of our committee as it moves on. God willing, we will be meeting in June, then we take a hiatus for the summer. And we'll probably be looking for a new chair of the committee. Again, I've done this for 2 years. And we'll see where that all goes in the next steps for the committee. Julie, as long as you're here, one of the things that we did say before, St. Stephen's not the best place to hold a meeting from a parking point of view. Unless we can get valet parking or something like that, I could have made a concession last night, probably could have made some real money doing that. So unfortunately, I was not able to attend. I did sit in my car for quite some time trying to get a parking spot, but it did not exactly work out the way I had hoped it would. Is there any other new business that folks would like to discuss this evening? Perhaps, Doctor, maybe you can give us just a little bit overview what you're feeling. I know that it's not necessarily in our catchment area, but it does affect us, and people do use Westchester as a primary area. What is the feelings around the ability to provide the proper level of healthcare from the perspective of your hospital?
No, I'd say off the cuff, I'd say I think it's a concern universally. While I think some of the challenges that are faced in the Bronx are not as necessarily as felt, there are community hospitals. I think that there are genuine concerns that people do have about the ability not to receive care, but our ability to provide it. I think there's a lot of talk about worry about what will happen, since a lot of hospitals do rely heavily on Medicaid. And I think there was an influx of cash and resources after COVID, and what will happen if that dries up, because I think that there are huge challenges to planning that happen with that.
I know last year, it was last year or the year before, I think it was last year, DSRIP, which was a reworking of the whole Medicaid plan for New York State, sunsetted. Hospitals and other providers became very dependent upon additional funding. That's all gone now. So being able to provide the kinds of opportunities, particularly here in Bronx, which has the lowest level of care in the entire state, it's really quite sad. I'm really hoping that people take the issue of the delivery of healthcare and the ability to deliver healthcare more seriously.
I think one thing that came up that I think as a benefit at the time of COVID was, I think the expansion of telehealth. And so for those who aren't in the know, they previously, I think you had to live, it was really only accessible it would only reimburse for very remote locations in very special circumstances. And with COVID, they kind of lowered the threshold and so allowed almost anybody to be able to access telehealth services and for physicians to be adequately reimbursed. And it proved to be a game changer for a lot, because again, I think sometimes the resource of getting out to a hospital, to a facility is a challenge. And then the ability to reach out, and that same thing, it's been flip-flopped. It was sunsetted, then we changed our mind. And so even that, in terms of concern about how long will that exist? Will it still exist? Will it exist in a modified form? Because again, I think access to care, and if you haven't, which is a challenge itself, right? Because obviously you have to have a smartphone typically, but even the fact that you may be able to see your provider at a distance, even have that phone call, and that's still.
I know that there are a number of providers now, we do it in NYU and going, where they actually have a technician go to the home and certain tests that previously can only be, conducted inside a facility, can be conducted at home. Various readings and different other kinds of electronic type of initiated tests. Is your hospital also utilizing that?
So to a certain extent, I think I won't state the name of there are companies, or there is an arm of the extension for Northwell at least, that will allow for somebody to come to the house and do lab tests. Which I think has been proven beneficial for some. In terms of the remote monitoring, I know that a lot of nurses, there's a lot of nursing care in terms of house visits. The availability and the extent to which is variable, because I think a lot of it does depend on catchment area and other resources, but certainly something that I think has the potential to be expanded on, particularly when you do think about, especially when you think about the elderly population, the senior population, where access to care, getting out is a challenge, and even something as simple as socialization and just doing simple visits and health visits and wellness visits can be beneficial.
Thank you so much. Is there any additional new business? Yeah, please.
There are these social care networks being established across New York State. Is part of CMS approved it, and I know there is funding till 2027. We do not know what, this was approved during Biden's presidency. So
what are these social care networks that are?
Basically, it's related to healthcare equity, and it's health-related social needs. So each area have a lead entity, and it's for Medicaid. If you have to have Medicaid eligibility to participate in social care networks. In the Bronx, Somos is the lead entity and they're just rolling it out. Perhaps we can reach out to Somos and they can educate our community going on how people can participate. It is looking into health care in a holistic way, whether you have employment, whether you have other social things that can contribute to your health. So there is a lot of funding for that project. It's supposed to be ongoing for a while, but people don't know what's going to happen with the new changes in Washington. But till 2027, it's funded enough to go till I think mid-2027.
So I did not know the provider here was Somos.
Somos is from Bronx, yes. I believe there are 9 lead entities in New York State, and Somos got the Bronx.
Because I know that my FQAC is one of them in Brooklyn. So I will certainly reach out, if I can reach out to some of the connections I have and see if they would come and give us a
Yeah,
brief.
so they're just rolling it out, I mean, it's gonna take some time to
But
establish.
maybe in the fall, right after the summer.
Probably.
I'm not sure we can get the,
Yeah,
it may be too early in the process for June.
Yeah.
Okay, let me do that,
it is a promising program, we do not know that it will be sustained.
yeah, well, all it takes is one presidential order for things to go bye-bye, Somos, okay. Okay, I will definitely, reach out to them. If there's no other new, business, and I really am grateful for those who showed from the committee, the fact that we now have approved minutes and approved budget for the next year. Really nice. It was getting a little, tiring of not being able to do that. I'd like to call, is there a, motion to adjourn? Motion to adjourn, second. Anyone opposed to adjourning? I don't think so. All right, listen, thank you so much. And again, Aubrey, please,
Thank you.
Come on back now. We'd love to
Oh,
have
thank you.
And thank you for everyone else. I hope everyone is doing well and enjoying the wonderful weather, even though it's a little wet. Supposed to be wet right now. Take it easy now.
Even showers being made flowers.
Good night.
Thank
Good
you.
night.
Thank you.
Take care.